The TIDAL study, which is looking at the PI3 kinase inhibitor Zandelisib, is going to evaluate it the second line study sort of establishes Zandelisib would be as effective PI3 kinase inhibitor with a little bit different caveats. So some of the more newer PI3 kinase inhibitors have explored the use of maintenance therapy, whereas that you get a full dose of the drug for an 8-week period, which is usually the first 2 cycles where you expect to get majority of the efficacy. Thereafter, a reduction in the dose, either the total dose or the frequency of how the drug is given. So with Zandelisib, once you get past those first 8 weeks, it becomes the 1 week on, 3 weeks off for the maintenance phase to try to maintain response and minimize some of the adverse events that we know are class-specific adverse events with PI3 kinase delta inhibitors. So with the minimization, we hope to get some restoration of regulatory T cells, which we know from long-term exposure to these class of drugs that gets depleted, which causes some of the autoimmune manifestations that we see, such as rash, pneumonitis, and diarrhea, colitis, which leads to drug discontinuation. So the hope is that the TIDAL study, with the positive results from that, has actually led to the formation of a Phase III study called Coastal, which is Zandelisib versus bendamustine and rituximab. So ideally, if that is a positive study, we would probably see an indication for Zandelisib. But because of all the lab publicity that we've seen with the other delta inhibitors, even with the positive results from TIDAL, that will not necessarily give that drug an indication. So the Phase III study is needed and will be required probably for all delta inhibitors moving forward to have a true indication, at least in the U.S.